Breastfeeding is a hot topic nowadays. Women tend to go back and forth about where it should be done and whether or not formula is a better option. What about mothers who go back to work? Is formula their only choice? Well, today we're going back to basics to answer these questions and more with pediatrician and parenting expert, Dr. Ilana Levine. Ilana, it's so great to have you back on the show.
Thanks, Tanya.
This is one of my favorite topics, being both a working mom and a mom who pumped at work. This is very important. But first, let's talk a little bit about the debate between formula and breastfeeding.
Right. Well, my role as a pediatrician is to make sure that my moms are educated about the clear benefits of breastfeeding, but then to support whatever choice they make, whether it's to exclusively breastfeed and use formula in combination, or formula alone.
That being said, there are some clear benefits, correct, to both the baby and the mother to
Absolutely.
breastfeeding?
Studies have shown a decrease in infections for the baby, decrease in respiratory infections, gastrointestinal infections. It helps with things like obesity and diabetes later on, so it's very important for the baby, and their maternal benefits as well. Decrease in breast cancer, ovarian cancer, you return to your original weight quicker. So I think parents need to know that.
And that's some new information, correct?
Yes.
The increased benefits to the mother. We're just finding all of this out.
More and more every day.
All right, great. So let's get to real life here.
Okay.
Unfortunately, in this country, most of us don't have the 6 months off when we have a child, which is what I understand the recommended minimum of breastfeeding is. Is that correct?
Right. Usually what I tell people is, for as long as you can is great. My first goal is to exclusively breastfeed for 6 months, but if it's going well, which it did for me, I continued on past a year even.
Okay. But you would tell women, even if they can just do 3 months, 4 months.
Whatever you can do.
Whatever you can do is fine. That being said, still, most women have to go back to work at about 12 weeks, 13 weeks.
Right.
So you've brought with you a variety of objects that can help with the process of pumping at work, correct?
Right. Exactly.
Tell us a little bit about it.
So the first thing you need is a good breast pump. This one, the Freestyle by Medela, is tiny. It clips onto your belt. It has a whole hands-free system. So if you're needing to take a conference call or type on your computer at the same time, it's great for those multitasking working moms.
I just have a question. How does it suction on and you don't need to be holding up?
Well, it has straps that'll hold it, or you could use something like this Easy Expressions bustier that has little holes cut out, and that keeps the suction cups in place.
So your hands are literally free.
Hands are free.
Unbelievable. This did not exist when I was going back to work.
This was my lifesaver.
Yes, and this would have changed my life. All right. And what about these bags? You say this helps because it just eliminates a couple steps, correct?
Right. You really want to make it as quick and easy as possible. So if you can pump into a bag that you can then twist tie, label, and store in the refrigerator or the freezer, you're not dealing with all the washing of bottles and things if you pump into a bottle.
All right. And you've got the car adapter there, which helps when you're on the go.
That's right. Battery adapter, car adapter. I use the car adapter all and didn't want to pump when I got home. I'd pump on the way home, put it right in the fridge or the freezer, and I was good to go.
And it's important for most working women to know that you need to during the day, correct, to keep up your supply?
Exactly.
And what advice?
Find a good lactation consultant, and you can do that. If you don't know one in your area, you can go on to www.ilca.org and you can find a good lactation consultant. There are things that they can do. There are hospital grade pumps you can rent. There are herbs like fenugreek and thistle that'll help you. So there's so many options out there for working moms.
What about drinking extra water? That's what I was always told. Does that help as well?
Extra water helps because the more you're hydrated, the more milk you're going to make.
And now what about finding a place at work to pump? Now, there aren't really laws in place about this, but you recommend that women should go and talk to their employers about maybe setting aside a room that's not a bathroom.
Absolutely. There is some legislation that's now in development, but I think it's really important before you have the baby, talk to your employer, educate your employer on the benefits of breastfeeding for both the mom and the baby, explain to them fewer days missed at work is better for the company, and really set aside an area where you can pump or breastfeed if you bring your child to work to make it more successful for you.
Because the bathroom is not really where you want to, you wouldn't prepare your lunch in the bathroom.
That's exactly right. It's not a clean place and it's really not acceptable.
All right. I've heard that in California, I've never seen this, but I've heard that in California almost every company has a lactation room.
A lot of companies do, and it's really a wonderful message that we give to moms that we're supporting them.
Hopefully other states will catch up with them in that regard. All right, Dr. Ilana Levine, thank you so much. And you can get more health and wellness information that's good to know by visiting our health page at abcnews.com. We'll be right back.